The Mental Health and Addictions pillar at St. Joe's is home to several highly productive research centers and groups that have earned international recognition. With the Department of Psychiatry and Behavioral Neurosciences housed at our West 5th campus, clinicians and scientists work together using a translational bench-to-bedside approach. Over the past year, Dr. James McKillop, director of the Peter Boris Center for Addictions Research and the Peter Boris Chair, was appointed as a fellow of the Canadian Academy of Health Sciences. Researchers in this pillar are leading some important projects. For example, the ongoing COVID-19 pandemic has led to tremendous stress, anxiety, and deteriorating mental health among healthcare workers. The Trauma and Recovery Research Lab, led by Dr. Margaret McKinnon, has been awarded 2 grants totaling $3.4 million to support trauma research and knowledge mobilization among healthcare workers and public safety personnel. This work is being supported by St. Joe's, McMaster, and the Homewood Health Research Institute. In addition, a team of researchers and clinicians have been developing the next generation tool called the Diagnostic Assessment Research Tool, or the DART. They aim to improve the timeliness and reliability of mental health diagnoses and increase accessibility to diagnostic tools through an open access model. The DART team, led by Dr. Randy McCabe and Dr. Elizabeth Pollock, published a pilot validation study in January 2022. A study led by Dr. Benicio Fry at the Women's Health Concerns Clinic found that sleep and biological rhythm variables are closely associated with the severity of peripartum depression and anxiety. Interestingly, higher fragmentation of nighttime sleep was linked to a decrease in postpartum depressive symptoms. The findings highlight the importance of stabilizing the internal biological clock during the peripartum period to maintain healthy mood and minimize anxiety. The Peter Boris Center for Addictions Research published a study that found alcohol and cannabis sales were higher during the COVID-19 pandemic compared to pre-pandemic sales. The research showed that alcohol and cannabis sales surged in March 2020 by approximately 15% over what was expected. While alcohol sales returned to more typical levels after the first wave stockpiling, cannabis sales remained elevated. This study, published in JAMA Network Open, demonstrated how macroeconomic indicators may serve as early warning systems for more long-term clinical impacts linked to increased substance use. Overall, it has been a highly productive year in the mental health and addictions research pillar.